Welcome to Chapter 8, the Blood and Immune System. The objectives for this chapter include understanding the function and main components of blood and the immune system, understanding terms related to blood, blood cells, blood components, and the immune system, defining word parts related to the blood and immune system, defining common medical terminology related to the blood and immune system, and understanding abbreviations commonly used when referring to the blood and immune system. Let's first talk about the anatomy and physiology of the functions of the blood and the immune system are to transport oxygen, carbon dioxide, nutrients, electrolytes, vitamins, hormones, and waste throughout the body. Also to protect the body with circulating white blood cells, antibodies of the immune system, and clotting factors, as well as to protect the body by naturally and artificially acquired immunity. The structures of the blood and the immune system understand that blood is classified as a connective tissue. 45% of blood is formed elements, and 55% of blood is liquid or plasma. So here's a diagram showing whole blood is composed 55% of plasma and 45% formed elements. Of the 55% of plasma, 91% is water, 8% are proteins, and then a miscellaneous other 1%. For the formed elements, we see that 0.9%, or a little bit less than 1%, are leukocytes and platelets, and the other 99.1% are erythrocytes. So let's talk about the structures of the blood and the immune system. When we talk about the formed elements that are produced in the bone marrow, we talk about erythrocytes, which are red blood cells. Their function is to carry oxygen. Leukocytes, which are white blood cells. Their function is to provide immunity. And thrombocytes, which are platelets, and their key role is in hemostasis. The blood plasma consists of 90% water and 10% of components transported throughout the body, and the immune response is the body's reaction to an antigen or a foreign pathogen. Here we can see the blood components. You see the red blood cells or erythrocytes, the white blood cells or leukocytes, and the platelets or the thrombocytes. Additionally, whole blood and blood-forming organs, the term blood is defined as the fluid that circulates throughout the heart and arteries, capillaries, and veins, transporting oxygen and nutritive materials to the tissues. Formed elements is defined as also blood cells. Plasma is the liquid portion of the blood that carries formed elements, clotting factors, minerals, and proteins. And serum is the liquid portion of the blood after removal of clotting factors and blood cells. Bone marrow is the soft tissue within the bone with multiple functions, including the production of blood cells. Erythropoietin, or EPO, is the hormone released by the kidneys that stimulates red blood cell production in bone marrow. And hematopoiesis is the formation of blood cells and other formed elements. The spleen is the vascular lymphatic organ responsible for filtering blood, destroying old red blood cells, and producing red blood cells before birth and storing blood. The erythrocyte, or the red blood cell, RBC, is the blood cell that carries oxygen and carbon dioxide. Hemoglobin, often abbreviated either uppercase HGB, HB or HGB, is the protein in red blood cells that binds to oxygen and gives red blood cells their characteristic color. Iron, or Fe, is the essential trace element necessary for hemoglobin to transport oxygen on red blood cells. Continuing with the formed elements in the erythrocyte, the macrocyte is a large red blood cell, and the term Rh factor refers to a protein substance present in the red blood cells of most people, about 85%, that is capable of inducing intense antigenic reactions. So here's an up-close picture of an erythrocyte, or red blood cells. When we talked about the formed elements, leukocyte, which is the white blood cell, or WBC, that's the largest blood cell, and it protects against pathogens, foreign substances, and cell debris. The granulocyte is the white blood cell with visible granules, and the three types of granulocytes are named according to the type of dye each is attracted to. So a granulocyte is a white blood cell without clearly visible granules. So here we see the leukocytes, or the white blood cells. A is the neutrophil, B is the eosinophil, C is the basophil, D is a lymphocyte, and E is a monocyte. Thrombocyte, or a platelet, abbreviated PLT, refers to the cell fragments in the blood that stick together, forming a clot. Here's a picture of thrombocytes, or platelets, and you can see the platelets in the purple and the erythrocytes. Blood clotting, still on anatomy and physiology of turns. So clotting factors, those refer to any of the various plasma components involved in the clotting process. Coagulation, clotting is the changing from a liquid to a solid state. Fibrin is the elastic fiber protein needed in clotting and produced by fibrinogen. And fibrinogen is the plasma protein that is converted into solid threads called fibrin. The immune system, so an antibody, an AB, is the soldier-like cell that protects the body and inactivates antigens. It provides immunity against specific organisms. An antigen, or AG, is an agent or substance that provokes an immune response. And a histamine is a substance released by damaged cells that increases blood flow to the area, causing an inflammatory process involving heat, redness, swelling, and pain. Immunity is the protection against disease. A pathogen is any virus, microorganism, or other substance that causes disease. Phagocytosis is the cellular process of eating and destroying substances, usually by the neutrophils and macrophages. Here's a visual representation of phagocytosis. So let's move on to word parts, now that we have some anatomy and physiology and some definitions. So chromo, or chromato, refers to colors, cyto to cell, erythro to red, granulo to granules, hemo or hematome. Hemato is blood, immuno is immune or safe, leuko for white, lympho for lymph, neutro for neutral, nucleo for nucleus, patho for disease, phago for eat or swallow, phlebo for vein, plazo for formation or growth, thrombo for blood or clot. Some prefixes you're going to see when referring to blood and immunity are auto for self and its same, basi or baso for base, macro for large or long, micro for small, mono for one, pro for before or promoting, poly for many or much. Suffixes include site for cell, emia for a blood or a condition of the blood, cis is for a condition or process, gen for origin or production, lysis for destruction or breakdown or separation, osis for abnormal condition, penia for deficiency, philia for attraction for, poiesis for production, formation, raj for flowing or forth, and y for condition of. So let's talk about some adjectives and other related terms for relating to the blood. So hematopoietic or poietic is pertaining to the formation of blood cells. Hemolytic is pertaining to the rupture or destruction of red blood cells. Hemorrhagic is pertaining to profuse or excessive bleeding. Hemostasis, stoppage or arrest of bleeding. Autoimmunity is pertaining to one's immune system attacking its own tissues or cells. Cytopathic, pertaining to a disease or disorder of a cell or cellular component. Hypertensive, a condition of excessive response or an exaggerated sensitivity to a stimulus. Inflammatory, pertaining to the process of heat, redness, swelling, and pain in the response to tissue injury. Predisposition, a condition of being susceptible to a disease. Proliferative is growing and increasing in number of similar cells. Rejection, immunologic response of incompatibility to a transplanted organ or tissue. Rejection is the immunologic response of incompatibility to a transplanted organ or tissue. Systemic, pertaining to the body as a whole. Virulent denotes an extremely toxic pathogen. Symptoms and medical conditions relating to the blood are anemia. That's a condition in which the number of red blood cells, hemoglobin, or volume of packed cells is lower than normal. Clotting disorder is a condition characterized by an inability of blood to coagulate. Hemochromatosis is the excessive absorption and storage of dietary iron in body tissues causing dysfunction. Pancytopenia is the deficiency in all types of blood cells. Polycythemia is an increase of red blood cells. And septicemia is the spread of microorganisms or toxins through circulating blood. Anemia due to impaired production of red blood cells, those terms are aplastic anemia, and that's a disorder in which bone marrow does not produce enough red blood cells. Iron deficiency anemia, and that's a disorder in which hemoglobin is unable to transport oxygen due to a lack of iron. And pernicious anemia is a disorder in which the number of red blood cells declines, which simulates enlargement of individual cells, for example, macrocytes, due to an inability to absorb vitamin B12. And here's a blood smear showing normal erythrocytes compared with erythrocytes in a patient with iron deficiency anemia. Here's pernicious anemia with a few macrocytic red blood cells. And then anemia due to the destruction or loss of red blood cells we'll talk about in the next section.